up in, are you in that children's building?
No, I'm down in
Good morning, everybody.
Yeah. So small world.
Yeah.
Everyone's grabbing their coffee and juice or whatever. We're going to go ahead and get started. My name is Alfredo Aguirre. I'm the Behavioral Health Director for the County of San Diego. Welcome to San Diego and to the 61st Mental Health and Substance Use Policy Forum. I made that number up, but it sounded pretty good. This year's forum features, the theme is improving access and reducing disparities for underserved populations. So I know I have some colleagues, friends here from San Diego, so I want all of you to join me throughout the next couple of days to extend a welcome to our visitors that are here for the forum and offer tips on where to eat, where to walk, where to have a good time, and in particular, please provide some intel to all the women in this conference about the warning signs to detect our ex-mayor who may be in close proximity. So it's really important.
Why isn't he?
So he's not here today.
There he is.
We had a bouncer kick him out anyway. So, by the way, this forum is particularly special because we'll be honoring someone who is very special, and you need to stay for the reception at 5:15 to really find out who that person is. I think some of you know. But anyway, we have a great program in store for you. Without further ado, the Executive Director for the California Institute for Mental Health, Sandra Goodwin Naylor. Or Naylor Goodwin.
It's either Naylor Goodwin or Goodwin Naylor. People get it confused all the time. But I do want to say thank you for providing this wonderful weather, Alpha. This is just great weather, and this hotel is beautiful. So thank you, Mr. San Diego. Oh, Susan is. Okay. Well, thank you, Susan. So let me quickly tell you that this policy forum that we provide 2 times a year is sponsored by 4 wonderful organizations, and the 4 presidents of those organizations and Tina Wooton, who is here representing consumers across the state, are here to welcome you to this policy forum, where we're going to focus on improving access and reducing disparities for underserved populations. So let me first introduce Jerry Wengerd, who is the president of the California Mental Health Directors Association. After that, you will hear from Senella, who's the president of the California Association of Alcohol and Drug Program Executives. Dennis Koch, who's the president of the County Alcohol and Drug Program Administrators Association of California. And you will also hear from Dr. Steve Elson, who's the president of the California Council of Community Mental Health Agencies. And finally, you'll hear from Tina Wooton, who is here representing consumers and consumer empowerment across the state. So with that, I'm going to turn over to Jerry.
Thank you. Thank you very much, Sandra. Where'd Alfredo go? He's gone. I wanted to ask him if he was going to run for mayor here, because it's in the news down here quite a bit. Welcome from CiMH. I'm the president this year. Sherry will be the president next year. I want to say about this particular conference, I'm really excited, and I'm really happy that this is the topic. This has been a topic in my whole career. Creating and maintaining the right kind of service and the right kind of access for all our populations that we serve has been a lifetime effort for most of us in this room. We've been trying to do this for years. It's our principle, it's our ethic, that's what we believe in, that's what we want to do, is maintain or try to create equal access. But after my career and after many, many years of doing this, we still aren't doing it. We're still struggling to figure out how to do it. We are much better than we were, say, 20 years ago. We're much better at it. But it still is unequal. It's still not, many of our populations are not getting served by us as they should be. And there's many reasons. It's not all our fault, but it's many reasons. So I'm hoping today that we have some takeaways from this that will change things a little bit for us in terms of what we know and how we'll approach it. So that's what I wanted to say about introducing our conference. I need one more few minutes to do a different thing, kind of a one-time event, and that's about Pat Ryan. So Pat Ryan, about 6 months ago, asked me to dinner. I said, boy, this is great. And now I want to say that as it goes, I have a clear visual of the restaurant, the booth we sat in, where she sat, where I sat. Everything is imprinted in my brain, one of those memories that's now forever. So in that scene, she started off by saying, I don't know how to tell you this. And then I interrupted her and I said, okay, then don't. You know what's going to happen when somebody starts a sentence with, I don't know how to tell you this. So we had a few bantering things about that because I already knew what she was going to say. And then the next scene in my brain that will be there forever is soon after, our executive committee of the governing board, sitting in my hotel room, eating and talking for a whole evening, virtually, about how to recruit. Who do we think we should try to recruit? How do we do this? And what kind of person? And blah, 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 blah. Went on and on and on. At that point, we really did have sort of a game plan, scratched on a pad like this, okay, by this date. So I felt pretty good. But after that night, and after meeting with Pat, I said, why me? Why does this have to happen on my watch? Why can't it be next year or last year? But anyway, that's the way life goes. So I'm really ecstatic to say to you all, and this is a good opportunity kind of industry-wide, not just for CiMHTA, I'm really ecstatic to announce that we conducted a very successful recruitment. And the result of that recruitment is here today for the first time. His name is Robert Oakes. He's supposed to be sitting here beside me, so I don't, oh, here he is. He changed tables. Robert Oakes, stand up. I'm not going to make you speak because this is just announcements, but I want everybody to. And our excitement, executive committee and the board, is that he is an advocate. He's a mediator. He has been a teacher. He's an attorney by trade. His last gig, if you will, was in a similar position somewhat with an association involving inside the school system or the educational system in California. But he has tremendous depth of experience here in Sacramento, not here, in Sacramento. We're in San Diego. Depth of experience in politics. Worked for a former governor. So in that world, he's got a tremendous resume that he brings to us. And again, I'm ecstatic that Robert took the job and that we found him, and we're going to have a good future. Thank you.
Good morning. My name is Elson. I'm the president of the California Association of Alcohol and Drug Program Executives, and also Tarzana Treatment Centers. I am honored to be here this morning. I was happy to be invited last year as well to make some opening comments. And on the subject of disparities, I kind of look at them in two realms, access to care and retention in care, but also in benefits. And just a few comments about each, and I think this afternoon there's another panel that'll go into a little more depth on disparities. But on the benefits side, as we were approaching the end of last fiscal year, things were looking pretty bleak. Early on, we were extremely excited about the opportunity to finally do something about the very restricted benefits for substance use services in this state, very unfunded, very restricted, as they are in many states. And that excitement began to drop quite fast after we had seen the governor's May revise in his proposal, and we were getting a lot of stonewalling from health services and from others about what could or could not be done with benefits. And one of the things that happened in the 11th hour, and I think only happened in the 11th hour, is because a coming together really had occurred in a big way over the course of last year between substance use, mental health, primary care stakeholders. That coming together, that we are stronger together than we are apart, really proved itself big time, because I think it's the only reason why ultimately there was an agreement to expand the drug Medi-Cal benefits in a number of very exciting ways. I won't go into the specifics now. But to also indicate, to the extent that the benefits were not made available under the drug Medi-Cal system, those benefits that were not there but were covered under the exchange would also be made available for substance use services. It was an absolute win that I don't think anybody expected. There's tremendous work to be done in defining those services and implementing those services and trying to figure out capacity to deliver those services, both in the provider side, the workforce side, but an absolute coup, if you would, that was totally unexpected at the level it came across. Again, that is only because of the help of folks like Sandra, like Marv, David Pating, and others, some of our champion legislators, that came to be so. On the service access side and retention side, the disparities there, which again, they'll be talked about in a little more detail later. Part of what I learned when I was asked to be part of that panel is there is not a lot of data out there when it comes to substance use services. Not nationally, not locally. There is some, but not a lot. Speaking with some of the researchers in the state, there just wasn't much to be garnered. But there was enough to indicate that there's a problem, that there has always been a problem with access to those services for certain populations, much more so than others. And there's certainly a lot of work to be done on that. But a couple of things came to mind as I was looking at that and wondering how much worse would this access to services be if programs that have been created over the years were not created. We certainly know that the criminal justice system is overly represented with minority populations. And if you look back, the programs that have been created to do anything about expanding substance abuse services have been in the criminal justice system. We created in-custody programs. We created programs for aftercare when they come out of those in-custody programs. We created drug courts. We created Prop 36. Now we've got AB 109 realignment. They're all targeted at a criminal justice population that is heavily, overly represented with minorities. And so when you look at the data in terms of access to services, even retention in services, how much worse would that be if it wasn't for those programs that often mandate individuals into care? So I think it's something worth more discussion and a harder look. Anyhow, I'll stop there. I thank you all, and we'll move on.
Good morning, everyone. Welcome here to the Policy Forum on behalf of CADPAC and myself, Dennis Cook, and more importantly from Fresno, California. When we talk about this nice weather here, I thought it was 72. I need to bring a jacket. My wife was telling me last night she was going to a football game at like 3 o'clock in the afternoon. She said, oh, it'll be nice. It's cooler there today, 97. Now, I know for you guys in the Bay Area that might seem a little bit odd, but for us, we're kind of used to it. Improving access and reducing disparities for the underserved. Well, the biggest group of underserved is those people that have substance use disorders. For years, we have struggled building programs on limited funding, limited benefits, a lot what Al had said. When you look at our drug Medi-Cal or Medi-Cal benefit, we're talking about two services, either group or methadone. We get a person that comes in for access or assessment, and if they say they're an injection heroin user, we say, yippee, we have something for you. Everyone else, we try to pigeonhole them into those two services. And every once in a while, we get to do an individual session. And that's been it. And again, if it wasn't for the criminal justice system, like Al said, and my entire tenure has been developing criminal justice programs. So if you look at our population, we align up with criminal justice. If a person comes in, we don't look as much at their diagnosis as much as we look at their rap sheet getting into services. That's how people get into care. And that's how we built our programs. But with the advent of the Affordable Health Care Act, that's going to change things. It's going to change things for those needy populations that are or not in the criminal justice system. We're going to actually have, and we are very excited, and we get 2 new benefits. Which seemed like a lot. And like Al said, when we heard the news of these new benefits, we were all very excited. Because now instead of 2, we have 4. So we have doubled. So I guess that is a start. Some of it's going to be a real challenge getting going. I doubt that it's going to happen on January 1st or 2nd, but it's probably going to happen after the first of the year. We have some huge barriers, no different than on the mental health side with the IMD exclusion, that whole mess. And how we're going to get programs certified, and how we're going to get programs contracted, the billing, the rates, time after time. A big concern for us is the rates. We pay our providers terrible. They pay their staff terrible. Average wage a lot of times is around $12 to $14 an hour. We want this person to be co-occurring capable, produce the best outcomes, and oh, by the way, as soon as they can make $16 an hour changing oil at a gas station, they leave us. Or their career path is they come in, they get registered, they get certified. As soon as they get licensed, they leave us. So we tend to be the training ground for a lot of other programs. Those staff that are dedicated to the field stick around, which is good. That's been kind of our backbone. But we have a tremendous amount of turnover with staff in substance use. And the only way we're going to change that, I think, as a whole, is as a system of care, is maybe to buy less services, but buy services that cost us more, that produces better outcomes. As we move forward under the Affordable Health Care Act, now we have this chance to build a system that more closely meets the client's needs. We'll be able to provide group sessions a couple times a week. We'll be able to provide intensive services where they come for 3 hours a day for 3 or more days a week. Residential services we'll be able to cover. I think at this point it gives us the opportunity to start really building a system of care for criminal justice clients as well as for those clients as not. So with that, I just want to say welcome here from CADPAC and have a good day.
A mouse looked through the crack in the wall to see the farmer and his wife open a package. What food might this contain, the mouse wondered. He was devastated to discover it was a mouse trap. Retreating to the farmyard, the mouse proclaimed the warning, "There's a mouse trap in the house. There's a mouse trap in the house." The chicken clucked and scratched, raised her head and said, "Mr. Mouse, I can tell you this is a grave concern for you, but it is of no consequence to me. I cannot be bothered by it." The mouse turned to the pig, and the pig told him. Pig sympathized and said, "I'm so very sorry, Mr. Mouse, but there's nothing I can do about it but pray. Be assured that you are in my prayers." The mouse turned to the cow and said, "There's a mousetrap in the house. There's a mousetrap in the house." The cow said, "Wow, Mr. Mouse, I'm sorry for you, but it's no skin off my nose." So the mouse returned to the house, head down and dejected, to face the farmer's mousetrap alone. That very night, a sound was heard throughout the house, like the sound of a mousetrap catching a prey. The farmer's wife rushed to see what it was. In the darkness, she did not see it was a venomous snake whose tail the trap had caught. The snake bit the farmer's wife. The farmer rushed her to the hospital, and she returned home with a fever. Everyone knows you treat a fever with fresh chicken soup. So the farmer took his hatchet to the farmyard for the soup's main ingredient. But his wife's sickness continued, so friends and neighbors came to sit with her around the clock. To feed them, the farmer butchered the pig. The farmer's wife did not get well. She died. So many people came to her funeral, the farmer had the cows slaughtered to provide enough meat for them all. The mouse looked upon it all from his crack in the wall with great sadness. So the next time you hear someone is facing a problem and think it doesn't concern you, remember, when one of us is threatened, we are all at risk. We are all involved in this journey called life. We must keep an eye out for one another and make an extra effort to encourage one another. Each of us is a vital thread in another person's tapestry. So that seemed like an appropriate story for this topic of reducing disparities, and as we do that, the entire community benefits. My name is Steve Elson. I'm the president of the California Council of Community Mental Health Agencies, and I want to welcome you as well to this conference, and delighted that the Planning Committee has chosen to highlight this topic. So CiMHA, as we're shorthand known, is a group of about 70 agencies in California. We serve about 30,000 adults and children a year. We're delighted to be able to participate in this conference, to be part of the Planning Committee, and we want to welcome you. Enjoy the day. Thank you.
Good morning, everyone, and welcome. Once again, my name is Tina, and I was a little nervous about presenting today, but as I looked out into the audience, I just saw so many people that have been a great support to myself and to the consumers and family members around the state. So welcome, everyone, and of course, I'm here to ask for your ongoing support for consumers and family members. And one of the things that I'm grateful today for is that you are looking once again at substance use and caring for folks that have those issues. It's very, very big and rampant throughout our state as well as our nation, so it's very important that we gather the skills that we can today to learn more about it. A few months ago, I think it was April or May, we had a big summit in Sacramento, and there were consumers and family members from around the state that were talking about strengthening our consumer employment and our family member employment. So once again, I'm just here today to ask you to continue to support our consumers in the workforce, whether it's within the system or without the system. If you could just take a moment and think what it would be like not to have a job, it would be pretty devastating for most of us. I know here at CMHDA that you have liaisons from CMHDA to different groups, and so I'm here today to ask if maybe you would have a liaison that would represent consumers and family members around employment around this state. I just want to say again that we're very honored that we've been invited to be here today. Probably over 15 years ago, maybe even closer to 20, I stood up here and talked about consumer employment. And so once again, just trying to share the word with all of you. And last but not least, as we move forward with our tasks ahead of us, with the Affordable Care Act and triage personnel enrollers from the ACA, I hope that you will look to the peers to help you in all those endeavors. And I hope that you will consider culturally competent staff, because if we don't have providers that can do outreach to our underserved populations, then it won't be worth anything. So I hope you keep that in mind as well. And then last but not least, I'd just like to say that it would be really great as we move forward and provide services to folks that we remember the MHSA values and principles, and that we care for folks in the least restrictive manners. So thank you very much for having me today, and have a great day. Thank you.